welcome. It's Dr. Brown from KNS Chiropractic, your Baltimore area chiropractor. Today we're here with Laura, and Laura's been having pain on her foot, and she's going to explain to you why she's here, what happened, and I'll explain to you how we're going to dry needle this and continue to get her better. Laura, tell them what happened.
Okay. Had an ankle injury that never healed. About 9 months after the ankle injury, I started having pain on the side of my foot. Went to a doctor. They thought it was a stress fracture. I was in a boot for 6 weeks. Came out of the boot. Didn't really help. Got an MRI and it didn't show a stress fracture. And that's when Dr. Brown suggested maybe it's an issue with the tendon and we should try some dry needling.
Right. You know, when Laura came in and it just wasn't healing and, you know, we were talking, you figure, you know, somebody has a stress fracture. You're in a boot. You break a bone, you go in a boot, you go in a cast, after 6 weeks, it's usually healed. She takes the boot off, she's in just as much pain as she had initially. So, being the great clinician I am, I said, hey look, maybe this isn't a fracture of the foot, let's try to figure out what else is going on. So, probably soft tissue. And we started dry needling it, and she's been having pain when she internally rotates the foot. It's still the only thing that causes her slight pain, and she's getting pain right in this area. So 2 weeks ago, we started dry needling. She's been in here 4 times. Today's her 5th treatment, and we've been dry needling this area, and it has helped significantly, right? Tell them.
Significantly. As Dr. Brown said, the only pain I have now is when I really rotate the foot. I used to have pain every time I got up from sitting down or got up in the morning from sleeping. It was really all the time, and now it's minimal.
Right. I mean, you couldn't wear your shoes that you wanted to wear, and
correct.
That's not good because she's very stylish. So we want to make sure she can wear all the shoes that match all these wonderful outfits she has.
That's right.
All right. So let me show you how we do this. I already marked the areas where she was having the irritation. So I'm going to show you how we dry needle this. It'll be a quick video, but it'll give you an idea on what to do when somebody's having pain in their foot that's coming from the tendons. So lay on your back. We'll make her comfortable here. Here, put you up here. Put your leg up here. And let's do this. Okay, so we already cleaned it. We are going to use, what are these, 1.5 inch needles. And we're going to put about 4 of them right in this area. So, why is this helping? It's not a muscle. I thought you're only supposed to dry needle muscles. It helps with trigger points. Well, that's not what we're doing here. What we're doing here is we're trying to stimulate this tendon. This tendon's been irritated for how long, Laura?
Since July.
Since July. It's, how many months is that, Hannah? Come on, girl.
6.
Right, 6 months. So what we need to do is, this area is very chronic. Your body doesn't even know that that's a damaged area. So what we're trying to do is put these needles in here. By putting these needles in here, we're stimulating those tendons, which is creating a reaction where your body is thinking, oh my God, this area is damaged. I'm going to bring blood to this area to get it to heal. And you know what? It's been working, and it's great. And we do this a lot for people, a lot in the tendon. Sometimes it's a little sore, going right into the tendons, right into those ligaments that attach right to this bone. Peroneus longus, peroneus brevis, tendons go right into that area. So we're going right into the attachment points. And you know what? It's working. Poor girl was in a boot for a long time, not getting any relief. So very simple what we're doing. And we're going to leave her on here for about 10 minutes. And we're going to take it off. And it's been the 5th, only her, she doesn't need glasses. Only her 5th treatment. And how much better are you, Laura, percentage-wise?
90.
90%, 5 treatments, I'll take that.
Yeah.
And she's been good. She's wearing her normal shoes now. This one's probably doesn't feel great because it's right into that ligament. I feel that. I'm going to put one more there and she will be good. Ooh.
Sorry.
That's all right. You can jump a little bit. It's going into your foot. And there you go. Laura, is it painful to do that?
No,
I mean,
it is not painful.
You were scared when you first came in because you didn't know what it would feel like to have needles be put in your foot. But it's really not bad. Doesn't cause pain. Too bad. If I hit a tender area, yeah, it might be a little sore, but it works. And it's an easy treatment, conservative treatment. Doesn't need any medicine with this. So look, very quick video. You have foot pain, it's not responding to conservative or to conventional medical treatment, call us. Call a chiropractor in your area, whatever. Try dry needling, it really helps. We will see you next week for another video. Remember, pain's not a lifestyle, and have a great weekend.